video. This is a sterile tray, which I've checked for the expiration date as well as to make sure that it's not damaged or wet, and it's not. I'm gonna go ahead and open it for Celestine, which she's gonna be the sterile one in the video, and she's gonna go ahead and open up the sterile tray and organize all the items inside of it. You wanna open up the sterile tray away from you, and she's gonna go ahead and grab it with both hands and put it onto the sterile field table.
Okay, so now I'm just gonna open this up. I wanna make sure I'm only touching the edges. And what I'm gonna do is get the tray ready for the doctor.
So Tegan is now the sterile person, and I'm going to drop the extra things that we need onto the sterile field, and Tegan's going to organize our sterile field. You want to open the objects away from your body and drop them onto the sterile field without touching anything. Try not to make them bounce like that.
Now I will grab this so that it's closer to the sterile field.
You can grab.
I want to do it closer. So with opening, you also want to make sure you're opening it right over the sterile tray so that there's a less of a chance of it rolling out. Perfect. See how she's doing it away from her, so she's not touching the inside or anything. Now she's opening the sharps. She already opened the large syringe and the small syringe. We have different size needles depending on what the doctor likes and what the procedure is. So you have to have everything available to them depending on what they need. Here's another sharp. And this is our syringe. Perfect. See how she slowly did that and it just didn't roll or anything? That's exactly what you want. Perfect. Okay, hi, my name is Tegan. I'm doing the sterile field. Now that we have everything on the prep tray, everything on it is going to be sterile. So I need to make sure I don't cross-contaminate. I'm going to organize everything so that the doctor is able to grab everything and see what he needs at that moment. So we have the large syringe. Right now I'm going to put that to the side and I'm going to get all the needles together. So here's one sharp, here's another. I will place these together so that they can find it. And you have little syringes. Just make it pretty because you never know what's going to happen and they need to be able to see what they have if they need it. And here's some more sharps as well. So I'm going to put these all together. If you have a razor, sometimes if you need to shave where you're going to be doing it because you need to clean everything. So put that there. Make sure all the little syringes are together. And we have some gauze and little napkins because it can get a little messy after. So now we'll place these back on top.
Hello, so I am the sterile tech, and the other sterile tech, Tegan, had already organized the tray for me. I just put on our drawing syringe, so our drawing needle, so that we can draw some sodium chloride. She's gonna help with holding while I draw. First I'm gonna do 3 cc's of the first bottle. We have 2 of the same. Sometimes the doctors like both. And then I'm gonna make sure that I just twist the orange off and pull. And then I'm going to set it here to the side, still close to the center. So I like to draw up 3 cc's of air first, because that's how your syringe will automatically drop the same amount of liquid. I'm going to have Tegan check the date for me, please, and pop off the cap.
So I will tell her what I have in my hand and show her the expiration date physically,
Thank you.
so that there's no confusion. And I will pop the cap, and then I will hold it up.
All right, so she's gonna hold it nice and firm. Let me press down. Thank you. I'm gonna, and can you point it down a little more for me? Perfect. All right. And I got 3, so now I'm gonna pull out, flick it hard so that you don't get any fluids in it. And I'm gonna put the top back on. Huh? Air. I'm gonna make sure that there's no air in it after I flick it hard. Also, I know I did that over the sterile field. That's a no-no. Don't flick your fluids over the sterile field. I'm gonna make sure the air bubbles are out, and they are. Sometimes you have to roll it. Now I'm gonna put my cap back on. Some people also like, so that they never touch by the needle, they like to draw it like that, but to me that can be difficult, and then I'm at a higher risk of dropping it off the table, so I like to just hold it and stick it right back on. So I have that, and I'm gonna put this back here for the radiologist. And now, Tegan, can we please draw of the second solution, which I believe is the same. What was that called?
9% sodium, and the expiration date is in 2 days.
Thank you. Okay. Okay. I'm glad that we're using it now. So then I'm gonna decap this one. I'm gonna put 4 cc's of air in, because that's what the doctor wants in the second syringe for this certain procedure. And Tegan's gonna hold it nice and firm for me, and then press down. I always like to have the holding tech press it down, just because I feel like they know how hard they can press, and I might not. So I feel like it's less likely for injury, especially since this is a plastic vial that our fluids are in. All right, so I got a big air bubble, so I'm just gonna draw again, just like that. Now I'm gonna pull out. Perfect, just like that. I've got this. We're gonna take the air out first. See, I'm now doing this not over the sterile field. I learned my lesson from earlier. And I'm firmly flicking this. And all my air bubbles are going up, actually. And then sometimes you have to do that. Perfect. Still have 4 cc's. We're gonna cap this. We're gonna put this right here. So if the doctor uses this, the procedure is done, we would always wanna put this just like this. You don't take off the needle. That's dangerous, and at that point it's a dirty needle. And dispose it in a red sharps container. Also, all of these things are one-time use, so we'd wanna make sure we throw them away in the proper use container for pharmaceutical drugs and things like that. Always dispose properly and safely. Not least, now that we're ready to call the radiologist to come down and do this fluoro procedure, because we have our patient changing, we're going to cover our sterile field. We never want to leave it unattended or even leave it at all without a cover once it's done being set up. So Tegan is going to open it for me, and I'm going to pull it from the outside. Perfect, she's opening it away. I'm going to grab it. Thank you, Tegan. I'm going to touch the edges. But even though I'm sterile, it's okay if I touch more of the edges. I'm gonna make sure it's nice and open. And then I'm gonna cover everything with it. And we can get it to look nice. And this is also nice too, because it's nothing, no debris or anything is falling on this. And also it's less intimidating when the patient comes in the room and can't see everything that's about to be stuck inside their body. It's kind of also a nice, respectful thing to do for a patient. Thank you for watching.
Opening the sterile gown. I am not sterile, however, I will be carefully opening and handing it to Stephanie, who is sterile.
And now she will hand it to me. I'm the radiologist.
Don't.
Okay, so now she will slip it into my arms. And I will be careful not to touch her, and I won't get my arms out fully. Okay.
I'm gonna take the back tab. And tie it, Velcro it, and find there should be a piece of paper that is already here that I will walk around the surgeon. You will grab the string and not the paper, because the paper is now not sterile, and tie it.
You have to grab the paper off it. Pull it 1, 2, 3. There we go.
After Tegan gets the gown tied, I will put her sterile gloves on.
Okay. Okay.
Don't let them snap.
So, while I'm doing this, I don't typically want to be spinning around or anything. This glove was backwards, so I did what I could, but in real life, I wouldn't do that.
I would hand it to her with her thumb
Yeah.
facing the correct direction.
So, now I'm sterile. Now I will adjust these all the way down. And keep my hands above my waist at all times. And I will make sure if I'm passing someone who's also sterile, I'll pass them front ways. I will never turn around and face my back towards them. Always facing.
Danger of glove.
So just make sure if you have old gloves that are really tight and you snap it back, don't let it snap your skin too. All right.